120,000 people drop dead of addiction every year. It's like 330 people a day.
We are still in the midst of the worst drug overdose crisis that our history has ever seen.
So in your many years of experience, how do parents usually respond initially when they either suspect or have confirmed that their child has substance use disorder?
Yeah, it's really tough, and really dealing with and working with parents who are taking care of a loved one with addiction. Part of it is a sense of really shame and feeling like, what happened? What did I do wrong that led me to have a child that has a substance use disorder? Is there something that I exposed them to? Is there something that I should have done differently? That's really the initial feeling, is one of guilt and feeling like, how did we get here? They don't want people to know that they have a child who's an addict.
There may be parents watching this right now who say, I am supposed to love my child.
Right.
But right now, that is really tough.
Yeah. I don't even know this person anymore. But that quickly turns into like, what can I do? Because people love their children. They want to do everything they can to make sure that they have the best chance at life. And so they want to really think about, once we get past the guilt and the shame, and I have really dealt with so many families that are like, okay, they call me Dr. J, like, what can I do? How can I support my loved one? And I am always grateful, because I always say, you cannot take care of somebody who's dead. So the main thing, our job, is to keep them alive.
That is profound. You cannot help your child if he or she is dead. And and that is the bottom line with addiction. This is a life or death matter.
And I think one of the things that is so important is that is the course of addiction. And so really thinking through, I may not have to like you right now. I may not even love you right now, but how can I be there to support and really go through this process, because I know that you're not in a place to understand the decisions that you're making.
And is part of that support helping parents understand that this is a brain disease?
I think what is so difficult about addiction is that it really is chaotic. It takes over this person, your child. It takes over their thinking, their decision making. It takes over parts of the brain that really control like their executive functioning. It's not a choice. There are actual changes that are happening as a result of substance misuse, right? So we know, like in the basal ganglia and in the amygdala, different parts of the brain that are really key for functioning and making decisions are affected grossly by substance misuse. So one of the things that we are able to say, it's really, really genuinely not a choice. And it's even more pronounced in young people. And I say emerging adults, really up until that 25, 26 year mark, because the brain is still actively going what's called pruning. Edits are happening in the brain during that time. And so then when you have substance misuse that come along, it really deregulates that healthy development. So it really, really is not volitional in an adolescent or emerging adult, right? There are key pathways that are being disrupted. Once I help parents understand that, they're like, oh, like I get it now. It's not because they were really trying to hurt me or trying to hurt themselves. That normal development is totally taken over by the substances.
And the third part of the brain that is impacted by this is the prefrontal cortex.
Absolutely. So one of the things that humans have is the prefrontal cortex that allows us to make complex decisions, that allows us to plan, think about the future, be able to be in intimate relationships. And so one of the things that we know happens with substance misuse, and definitely in a substance use disorder, right? Compulsive use over time that affects decision-making, is it really has detrimental or harmful effects on your prefrontal cortex. The good news is that when people are able to have sustained recovery over time, meaning to minimize or stop their substance use altogether, there is a neuroregeneration or new cells that grow and your brain is able to heal itself, which is awesome.
I was so relieved when Dr. Amen told me that. I was like, really? My brain's going to get healthy again?
Yeah. Because people say, okay, my teenager or my young adult, like, will they ever get better? How will they be? And we have now the studies and the scans to demonstrate that in recovery over time, without the insult of the substance, you can get better. And so that is really hopeful, right? Yeah.
Interesting that you called it the insult of the substance. What an insult.
Yeah.
I want to hear a little bit more about what happens as the brain is maturing.
A lot of folks don't realize that our brain is actively going through developmental changes up until age 25. And so what does that really mean? That actually means that there are connections that have not formed yet that are responsible for how and what decisions we make, where we live, right? What is happening in our environment, how we interact with the world can actually affect neuronal changes in the brain. Also, what we take into our bodies can impact what pathways get strengthened and what pathways are weakened. So when we have, and I like to use that word insult, when we have a repetitive insult to the brain over time, the healthy connections that would develop in the absence of that insult is not able to properly occur. And so that's why prevention is really, really, really important, and really thinking about what are young people being exposed to during that time of development up to age 25, but also thinking about if they've already developed a substance use disorder, how can we strengthen other parts of the brain through environment that is healthy?
So how about some examples of that?
There are things called ACEs, which is adverse childhood experiences. So those are things that can cause negative effects on the brain, right? Growing up with a parent who maybe misused substances in the house, or growing up with parents who, really had interpersonal conflict and led to a lot of domestic violence. That can all cause negative problems in the brain. So one of the things that we do to try and counteract that and really allow for positive development are things like going to family counseling, thinking about adaptive coping strategies. How do you communicate in a way that's not arguing, that affirms the teenager, that allows them to really think about the consequences of their decisions and able to talk that through? If someone had an adverse experience, doesn't mean that they're going to be messed up for the rest of their life. There's a type of therapy called cognitive behavioral therapy. CBT, exactly, that allows you to think it, catch it, change it, to think about whatever negative thought you're having, the feeling associated with that thought, and then reframe it in a more positive way.
So literally there is something to thinking positively.
How you think affects your brain, which affects behavior and allows you to make better choices.
What are the three things again?
Catch it, check it, change it.
Catch it, check it, change it. Tell me more.
Catch it, check it, change it. So really catch that negative thought, catch it in the act. Why am I feeling depressed or feel like I'm a failure, right? Check it. Where is this coming from? Is this related to me feeling like I wasn't good enough or thinking differently than the other kids at school, right? Being able to associate that negative thought with what is the origin of it, right? And then change it. No, just because I have learned differently or I'm not like the other kids, that doesn't mean I'm a failure. So we want to catch that negative thought, check it. Where did it come from? And how can we change it and frame it in a positive way? That process is really taught to young people with addiction in a way that it just becomes second nature to them so that they're able to reframe, think about more of a positive outlook. And that can help in terms of establishing and maintaining recovery. These are all things that have shown to help young people especially have more positive connections. And it actually leads to really positive changes in the brain that can minimize the effect of the substance use. I have been in this business long enough to see that with these adaptive coping strategies and medication when necessary, people really do well. And it can balance out those negative insults from the substance use.
You talk a lot about how trauma can have a major impact on substance use disorder, particularly childhood trauma.
Yes.
And childhood trauma can look like a lot of different things.
We really think about childhood trauma in the way of like domestic abuse or childhood abuse or things like that. But we have to be a little bit more expansive because there are different ways that children and adolescents can experience trauma. And one of the things is really thinking about their identity. What happens during that teenage development is, who am I? Where do I fit in the world? And what is my contribution? And so I do see people that are like stars in college in terms of, being athletes or running track and field or cheerleaders or having a particular talent with a musician. And then that chapter comes to a close. What does that do for their identity, right? Who am I? And how does that affect their thought process of where they go in the world? Lots of times there's a void left. And that can be a particularly vulnerable time because there's no more outside adoration, admiration for who they are because they're not doing it anymore. So that can be what we talk about in the field of psychiatry is a traumatic loss. There's not a particular trauma that has occurred, right, for that teenager, but losing that sense of identity, having years and years of that reinforcement, and then all of a sudden that's gone away.
A lot of times young people fill that void by drinking, drugging, etc.
Exactly. And so it's not, unfortunately, uncommon for people to feel that euphoria from substances. So wanting to drink a lot to kind of escape or to get high to feel good about themselves again. So one of the things that happens in trauma-informed therapy modalities is, how do you deal with the traumatic loss and replace it with something that is healthy, that allows you to understand that your self-worth is not dependent on what you do or what you have done, but really just because of your humanity as a person. That's powerful, especially as we go back to the developing mind and how those key connections are taking place. That has to be sustained over time. And a lot of times adolescents need help in working through that process.
What about pure physical abuse?
Yeah.
How does that affect a young person in terms of increasing the likelihood of developing substance use disorder later?
There's many different ways that it affects the child in terms of using substances to cope. Part of it is truly biological. There are changes that happen as a result of being a victim of, abuse. There are changes in the DNA that make them more susceptible to needing immediate gratification. I need to feel better quicker. And that happens, they're wired that way because of that violence that they've experienced. So there's actual changes in the brain that happen as a result of that. So that's kind of like on the biological level. On the social level, there is what we call improper attachment styles. They don't have that nurturing, caring environment that is necessary for those healthy changes to occur in the brain. So they circumvent that by trying to keep themselves safe in other ways. So one of the ways that they can create that safety artificially, but the brain still understands it to be safe, is getting gratification through substances, things that make them feel better, things that make them feel safe. So again, that improper attachment that comes with being the victim of abuse puts them at greater risk because they are trying to access that euphoria or safety through substances. And then we have to think about the emotional response to being a victim of abuse. there is a sense of true deregulation of emotions that come and not being able to really cope in a healthy way. So thinking about, I feel like a loser. I feel like it's my fault. Is there something else that I could have done so that I didn't upset or make my parent angry that caused them to beat me? So there's always this anticipatory, what can I do? What can I do? So altogether, this puts someone at risk for using substances to kind of deal with the trauma of the abuse itself, but also on a biological level, being primed to kind of crave and be soothed by the substances. So it works a myriad of ways. And so you have to really unpack it. But one of the key questions that any specialist will screen for, especially with a child with a substance use disorder, is childhood trauma, but specifically abuse, physical abuse, sexual abuse.
What are some of the signs that parents can look out for?
Things like a sudden change in the way in which your child is behaving. So if they are usually a very social person that interacts with others, and then there is a change, they're staying by themselves, or they're staying in a room, or they're having irritability or unresolved anger outbursts. Those are like really key signs. Another thing is their performance in schools, suddenly a precipitous drop in their grades. It's normal, we all know, for teenagers to sleep a lot, but not for the majority of the day, right? Not having any drive. And another big one is having a loss of enjoyment from regular activities. If all of a sudden they're no longer interested, those are things that you have to really watch out for. Don't second guess yourself. Like if you are really seeing something, if you see something, say something. I always say it's better to err on the side of like going to someone, a professional, for help and saying like, listen, I'm not sure if this is just normal teenage development or if there's something wrong. And honestly, I always say it's better to intervene early than to wait. And when it's further along, because it takes a lot more time to have to intervene then.
Do parents wait because they're in denial? Maybe they don't want to believe it's true. Maybe they're scared. Maybe they think their child will outgrow it. All of the above?
All of the above. People don't want to accept that, one, that they're dealing with a child that has a substance use disorder or that has a mental illness. That's very difficult because of the othering and the stigmatization that occurs of people with addiction and mental illness. So I get it why parents wait, but also my thing is, if you don't get treatment, it's not going to get any better. In fact, earlier treatment actually helps teenagers not have to deal with like involvement in the carceral system, like getting in trouble or legal trouble. It also helps with like educational outcomes. It helps with people able to get a job and stay employed. So I always say, even if you're embarrassed, you don't want your friends to know, it's better to get help early. And it's okay to think, will my child grow out of it? We don't know, maybe, but just go ahead and get help
Let's
early.
not leave that to chance.
Yes, exactly. There's no reason to.
So for parents watching this who may be reticent.
Starting with your pediatrician or family medicine doc or primary care physician and saying like, okay, how do I help my child who may have a learning disorder, ADHD, dyslexia, social emotional disorders? How can I get them the help they need? One, to have a diagnosis. Because I always say, you can't treat something if you don't even know what it is. Can you refer me to a licensed specialist that can help? And that will get the ball rolling in terms of where does your child need to go for maybe a diagnosis of a mental illness or learning disability, and if necessary, for the substance use disorder as well.
And so if they're having trouble learning, they might say, I'm dumb, so it doesn't matter if I use drugs or drink.
So make them understand there's nothing, that is innately wrong with you. This is what you're dealing with. Let's treat it so that you can get the help that you need so that you don't have to self-medicate with substances. And that's really important. And so I say to parents, it's like, don't feel embarrassed if you see or if you know like something's not right. Maybe your child is having difficulty. They're failing everything. It might not automatically be substance misuse. They might just need a psychologist to get them the proper diagnosis, right?
You have talked so much about how co-occurring disorders are very common.
Yes.
Like I think 9 million people in this country have co-occurring disorders, or what used to be called dual diagnosis.
Right.
And that is substance use disorder plus mental health issues. What are the biggest risk factors for that?
If you are not getting treated for your bipolar disorder diagnosis or major depressive disorder or anxiety disorder, that puts you at higher risk of developing a substance use disorder, right? So that's really important. If someone really is dealing with a co-occurring disorder, that can have a profound effect on how they interpret the world. And so we want to make sure that we're minimizing those toxic kind of external stimuli and getting them the help they need. But the bottom line is, what we do know is when you get treatment for both simultaneously, that sets your child up to have the best treatment outcome.
But, you know, addiction still lives under this cloud of stigma and shame.
Yeah.
And, you know, I know certain communities are more affected by it than others. What I've tried to do the last 15 years is put a face on this disease and try to address the stigma and the shame, because shame and stigma accomplish nothing.
What we're finding now, and this is why I really appreciate like the power of the media in a good way, of like people being honest about their struggles. People in the media saying like, no, get help. It's okay to see a psychiatrist or a physician or a psychologist, some other type of health professional, because you can't just keep it inside. That actually creates more isolation and fear and can actually make the substance use disorder worse.
So what is your message to families out there who are worried about telling their friends, or they're worried, I don't want my church to know,
right?
God forbid my colleagues at work find out my kid's on drugs. What do you say to those parents who have those concerns?
I say to them that I can only imagine the amount of devastation and despair one must feel to have to hold that shame. But we're in the middle of the worst crisis this country has ever seen. You have to talk about it, because that could be the lifeline to get your child the help they need. And what you will discover is, as you start to tell more and more of your story, you take the sting out of it. People cannot hold that against you. You know what? This is something that my child is dealing with, just like if we were dealing with type 1 diabetes. The consequences are too high. If you're struggling with addiction, it's not something you can just pray away. If you're struggling with anxiety and you're self-medicating with benzodiazepine, Xanax or Ativans or whatever, it's not something that's just going to go away on its own. You need treatment. And so that normalizing of the story really does help.
And the whole family needs treatment.
Oh my gosh.
So let's turn to that.
Yeah.
Addiction is a family disease.
Yeah. That framing is so important, because again, we talk about, and Laura, you know this firsthand, the havoc that it can cause on others, loved ones, relationships, to the point where even when someone initiates their treatment journey, there's so much disdain and hate, and the family is left in disarray. How does one not only get treatment for the child, but how do we as a family start to communicate with one another, irrespective of the child? How do I talk to you, see your humanity, and begin to relate in a way that can be supportive of each other as loved ones of this child, but also really be able to interact with a child who is very vulnerable and early in the recovery journey? So it's not just sitting down and talking it out. It's really thinking about a licensed therapist that can say to you, okay, we're going to navigate this disease process as a family. And that has really, really helped in terms of sustaining a loved person's recovery and like how to deal with the devastation and the aftermath that was left because of the addiction. Yeah.
Yeah. And it's hard.
Yeah. It takes a lot of work, but it can be really transformative to help someone initiate their treatment recovery journey and stay in recovery. You don't have to do it alone. And that's why the Real platform is here. It's helping people be informed with the information necessary to get help. But we as a society have to be loving and caring. Yeah. And so I try to do that. I try to do that with my patients, and they'll say, "Oh my gosh, Dr. Jordan, you are so kind." And I'm like, "Of course, I'm never going to kick you out of treatment, right? I'm going to be here with you along the way because I know it's a journey and we'll get there. We'll get there together."
Is there anything more remarkable than watching a human being transform?
It really is the reason why I have drive and passion for this work, because I know the potential of what can happen when someone is in treatment, is loved, cared for, and supported, and is able to, have a better life.
So why can't my kid just stop?
Because it's not easy overnight kind of switch that just came on. There are many different processes that lead to it. We know that there's genetic predisposition. They can't just stop because they have disrupted pathways in the brain that were not developed accurately because of the substances. They can't just stop because they're dealing with the emotional chaos of now having a substance use disorder. So in the way that there are multiple pathways that are affected, both biologically, psychologically, emotionally, and if we talk about those adverse childhood experiences or ACEs, environmentally, there's so many things that have to be addressed before they can just stop. But when we understand that it's not something that's just going to be fixed quickly, and we understand the complexity of having a substance use disorder, that allows us to have more empathy. The good news is when we systematically start to unpack all of those things, we actually have treatments that can help and allow people to live totally normal, healthy lives. The best thing for me is I get a letter. "Dr. Jordan, thank you so much. 2 years ago, 5 years ago, you treated me for this. I'm well. I graduated." Or getting from a parent, "Thank you for not giving up on us. I had given up on my son. I hadn't seen him, but now we're in treatment as a family." It's not an overnight process. And like we talked about earlier, is we know that it takes time for your brain to recover from those insults, right? So it's not going to be 30-day in and out or 90-day in and out. No, this is a process. And how can you support your loved one so that they can get the time? It takes time. And I am just really excited. And I want to tell parents, stay encouraged, because treatment does work, right? Recovery is possible.
I am living proof of that.
Yes.
And there are 25 million of us walking around this country who are proof that recovery works, that you can improve your life, and that you can live and not die.